The Tribal Health and Human Services Department of the Confederated Salish and Kootenai Tribes is proud to present Good Medicine, a program dedicated to the wellness of the Flathead Nation. The mission is summarized quite simply: a healthier people, a stronger nation. We will strive to make good medicine a reliable source of ideas and information about health issues so that everyone can make informed decisions about their own lifestyle and health care. You will meet health professionals, tribal government and spiritual leaders, and interesting people from the tribal community discussing important health issues that profoundly affect us all.
Good afternoon. I'd like to welcome you to Good Medicine. This is a new program that we are now presenting weekly from the Tribal Health and Human Services Department. This week we're going to be interviewing and talking with Marjorie Bear Don't Walk. She is our new Department Head of Tribal Health and Human Services. And we just want to welcome everybody aboard, and we hope that this will be very informative to you and in the future. Marjorie, you've come to us recently from Billings, and I would like to just ask you just briefly, tell us a little bit about yourself and give us a little bit of your background on your health as far as the health field.
Oh, I thought maybe you were talking about my personal health.
Well, we'll get to that later.
Oh, okay. Well, as you know, Larry, I went to school at Dixon.
Okay.
When you were there, a very small child.
Very young.
Yes, very young. And I graduated from Hot Springs High School, and I have a degree from Montana State University. And I've done numerous things over the last, I hate to say 30 years, but it's been 30 years since I graduated from high school. And I've recruited students into health careers in the 70s. Very few Indians were in health careers in those days. And a lot of those students now are doctors and dentists, pharmacists, that kind of thing. And most recently I've run an urban Indian clinic in Billings for about 10.5 years. And I've done some work on the national level with Indian Health. I've been a part of the Indian Health Service redesign team for 2 years. I've been a part of the Indian Health Service Women's Health Initiative, and most recently I went to Ottawa, Canada for an American-Canadian Women's Health Conference, and that was about 3 months ago. So I also was president of the American Indian Healthcare for 2 years, and attended the budget hearings with Dr. Trujillo, both in the Senate and the House, and have been a part of, or at least have been aware of the national direction for health and Indian health. So I've been interested in seeing the improvement of Indian health, of health for Indian people.
Well, I can see where this would have probably led you towards the direction of the job that you're now sitting on. What interested you, though, exactly in this job as far as becoming the director of Tribal Health and Human Services?
Well, I've been gone for 30 years, and I think anyone who leaves home always wishes to come back, and so this is really an opportunity to come home. I don't know if the people here who live here appreciate the beauty of the Flathead Reservation, but most of the reservations I've been to are kind of barren pieces of land where they put people. That's not true here. And so I'm temporarily living at Polson in a rental on the lake, which is really terrible, you know. And yeah, literally the pits, right. And so I'm driving to St. Ignatius every morning, and even in the snowy weather I find it enjoyable. So I've wanted to come home for a long time. All of my family is here. The only person in my family who ever left was me. Mm-hmm. So my mom lives in Arlee, and all my brothers and sisters live in the area.
Well, welcome home.
Well, thank you.
All right. What part do you think public education is going to play in the effectiveness of tribal health in the future?
Well, one of the things I did with my other job is that we had a weekly television show in which we promoted health care. And the Indian Health Service is funded by Congress at 65% of need. And so the Flathead health program is funded at 65% of need. So unless there's some big miracle where Congress funds Indian Health Service at 100% of need, we will never meet the needs of health care unless we become a lot more efficient. And probably the best thing we can do is health education so that people take care of their own health. And probably the most important thing in that area is that we treat each other better, and that we care about each other, and that will go a long way in reducing healthcare costs.
All right. You know, that was part of a philosophy, as you just said. Is there any other more of a philosophy that you want to expand on right now that you think is going to help the Tribal Health and Human Services as far as in our departments, expanding our dollars?
Well, I don't think we realize how lucky we are here. I don't think we're grateful for what we have. On Flathead, the tribe here is much more, is well known across the country for being efficient. The tribal leadership is respected across the country. I think that this Tribal Health Department was the very first compact that the Indian Health Service ever did. I think that it was an honor for them to respect the administration to do that. And so I think we need to look at the positive parts of it and the opportunity we have to provide services to all of the people in an efficient manner. And the only way we can really do that is to become efficient. And that would take a tremendous amount of change. And we all know that change is very painful for people. And so there's a need, excuse me, to deal with change and how it affects people. But the reality is that the world changes every day, every minute, every second, and that we have to change also. And so there's a need to change in a positive manner, not just change for change's sake. But I do see a need for more efficient health care and a need for more consumer-oriented health care.
All right. How would you expect us, the Tribal Health Department, to balance patients' rights and patients' responsibilities in the future?
Well, I think that that they both have to work together in any healthcare system, that the rights of patients are primarily to receive adequate, decent, fair health care in a manner provided by professional people who understand the standards of healthcare. And I think the process is not separate, and I think we that can only happen if we all talk and work together. And it's very difficult to see the overall picture. We pretty much only deal with our own personal health care. And for those people who are very healthy, we need to look at how they maintain their health, how they, and they need to be rewarded for doing things right. And for those people who need more health care than others, we need to look at it from a positive standpoint also. You know, I mean, I understand that you've been through tremendous health care. You had a transplant, right?
Right. 5 years ago.
And thanks to modern medicine, you're here, and that you had the opportunity to achieve that. So.
Right.
Did you feel in the process, have negative feelings about not trusting the system? And
Yeah, you know, the problem I ran into was how was I going to afford the expense, my downtime that I was going to require to heal back up. But the system that was in place, because I also had outside insurance, opened up a lot of doors to me that has been a really wonderful benefit to me. as obvious, you can tell me sitting here, I'm basically healthy.
Look healthy to me.
There's some questions about that out there in the world, but
Let's just say physically healthy.
physically, that's right. And, you know, I will be here for a long time, and hopefully you'll be a real productive individual for tribal health in many ways. And, you know, and that's, I guess, why I'm encouraged about the change that you're starting to represent. And that's, I think, where we should start to follow up into. As a patient, I had responsibilities. What is your idea on the prevention that we can entertain throughout the reservation as far as preventive medicine for our people, as far as health, physical exercise, anger management? Anger management,
right. As I understand it, the most costly health care problems that we have are smoking and drinking, smoking and drugs. That smoking leads to strokes, heart attack, lung cancer, and that's very costly in the end stages. Substance abuse, the most costly part of that probably is the car accidents and the other violence that comes from that. But if you look at all of it, my view is that for 500 years, before Columbus came, Indians were healthy. We survived. If we didn't have the ability to survive, we still wouldn't be here now. And so when we became people who were not socially accepted on our own land because of our skin color, we had to survive the 500 years of racism. And in that process, a great toll was taken even though we survived it. Racism is a very costly health care issue. If you treat people like they're not capable, they think they're not capable and they act like they're not capable. And so the very people who are racist are going to need to contribute to the people that they're treating badly. So, and the other side of that is if people treat you with racism, and you're surrounded by people who treat you with racism, you become a racist because that's the only type of behavior modeled. So you also become racist to yourself. You're not acceptable. And so the way we comfort ourselves when we're treated badly are through all of the addictions. We smoke to comfort ourselves. We drink to comfort ourselves. We take drugs to comfort ourselves. We overeat to comfort ourselves. We gamble to comfort ourselves. And so there are all of these things that are addictions that we comfort ourselves with. And so treatment for those addictions is very expensive. And so if we dealt with the self-esteem issues and the racism issues, and how we have learned to be racist towards each other, and how we learn to evaluate each other and to be critical of each other, what the cost of that is. The one thing I've found since I've been here that's very interesting is the high level of anger. But that usually goes along with racism. And anger is an interesting issue. It's a part of grief. It's one of the parts of grief, and so we need to grieve our losses, we need to grieve our pain, and we need to get on with things and let go of all of the anger. We have a lot to be grateful for. First, the place we live in, the conditions could always be better, but for the most part, this tribe is very lucky.
You know, on that issue, how do you think the national trends are going to start to affect tribal health? You know, we hear about HMOs, we hear about, you know, get somebody in the hospital, get them out as fast as possible. How's this going to affect us as tribal health people that we're on here on the reservation?
I think all of the national trends affect everybody in healthcare. I don't think that anyone is exempt from that. And I think it hits tribes a little bit later. But one of the things I've noticed in private practices is that, particularly in Billings, there are 2 hospitals, St. V's and Deaconess. They have bought up all of the private practices. And so the way that doctors conducted their business in the past no longer exists. They are not in control of their own health care. They belong to a system. And so when you want to hire a doctor part-time, they already belong to some organization. There's lots of changes that affect us. All health programs, including tribal health, need to third-party bill. We need to supplement our income with third-party billing, and Congress passed some legislation some years ago to third-party bill. And so we go after insurance, Medicare, Medicaid, and so whatever happens in those areas affect us directly. The state of Montana is privatizing its substance abuse and mental health services, and they have contracted it out to a large corporation. That is going to affect everybody because it will affect the Medicaid services provided by the state in those areas. Montana is also developing HMOs for its welfare clients, and of course we all know that welfare reform has been signed, and that will affect the eligibility of Medicaid patients. And so all of the national trends will affect us in some way and are affecting us now. We need to supplement our income because we're only meeting 65% of need. We need to look for other funding sources. We need to look for other programs that we're eligible for. And we need to run the programs we now have efficiently.
Okay. How do you see us making our programs more efficiently?
Working together.
Okay.
I think that makes a big difference. We all need to be going in the same direction. And so I'm planning some training of bringing in a consultant and all going through the mission statement that the tribe has developed and the philosophy, and bringing tribal health and human services into line with those philosophies and mission.
Okay. As far as costs go, are we exploring new areas to bring in new ways, new revenues? Are we going to be finding ways of containing costs?
Last year we had numerous vendors that provided physical therapy. Recently we have put out bids to see what is the most cost-effective way that we can provide the same services. And so a number of people bid on providing physical therapy to the tribe, and the Tribal Council voted last week to accept 2 vendors so that the people have a choice, and they have agreed to provide services to us at a reduced cost.
All right. With that, what I'm hearing you say is everything that is coming through tribal health, does it funnel through tribal council basically?
I think the basic policies have to be funneled through tribal council, and I think that any change is difficult for people, and so the tribal council hears from the people when they're upset about any kind of a change, and so it's very important to keep the communication lines open. So people still have the ability, to talk to a council person who will have some direct say in the managed care for people. The ultimate decision, of course, is the tribal council because they're elected leaders, but they have asked us to provide certain services in the direction that they want us to do, and that's what we're trying to do.
All right. Are we bound to see some sort of managed care in the future, in the near future, as far as how we, how people are affected, on the reservation with their health?
I think that we have to become more cost effective in order to continue providing health care. And I think that like any system in change, that the pendulum will swing all the way to one side and then it will swing back towards the middle. I don't think the pendulum is finished with managed care, but I don't think any of us will be exempt from at least providing some services in the area of more managed care than we do now.
So people will become more involved in their own health care, though. I mean, that's what I'm hearing you saying in your program, which is exciting to me because of where I've been in my life. And that sounds great. You know, the thing I hear in my travels upon the reservation is that tribal health is undergoing some major overhauling in the organizational charts, in management. Can you fill us in on that just a little bit? Maybe we can take some of the rumors and tell truth out here.
There's a giant organizational chart in my office now, and it has all of the people and programs up there. And we made it that large because we wanted the program managers to look at it and to discuss and to have their input. And we've asked a lot of people about what is their suggestion in a reorganization. And before I arrived here, Joe Dupuy had started some reorganization. And so there's great discussion about the direction we need to take. We've been, the program has a contract for Montana Primary Health Care to come in and look at the services we're providing. And because we receive third-party reimbursement as a federally qualified health center, there are some federal guidelines that we must abide by. And the general consensus is that we're top-heavy, that the services need to be more, or at least the positions need to be more of service providers than administrators. And so there are lots of areas to look at, and there will be changes. There will be no other way to provide cost-effective health care.
Okay.
But there has been no direction from the Tribal Council to fire anyone. Attrition will be made through people leaving their jobs. There is not, I understand the rumors are very interesting to me, but very little truth to the majority of the rumors.
I've seen that and witnessed that. So is it true then my name is still on the charts?
I'll have to look.
Okay, do that please. All right. Will we be downsizing, or will there be any layoffs because of what's going on within tribal health right now?
That's not planned.
Okay. Okay, so that's good. Are there any services likely to be cut through all this, you know, new management, through you know, the cost effectiveness, trying to figure out how we're going to make the 65% of the money, you know, work for us?
That's not planned either. There will be reshifting. There will be some changes. And what I have found is that if you accept that change is a part of your life every day, that you can adjust to just about anything. And so the employees need to understand that that's what we're planning, is a more cost-effective, consumer-friendly service, and that training will be required by everyone. And we're not planning on firing everyone and finding, you know, consumer-friendly people. We're planning on just training and restructuring within.
Okay. So,
except for you, Larry.
Except for me, thank you. How would you say you've seen this first month go for in your new position as program director?
Well, I've spent most of the month learning, you know, and it's been really interesting. I think that probably my reputation preceded me, and it's an unfair reputation. I'm much sweeter and kinder than that, than what's portrayed.
All right. Okay. What do you see as a long-term evaluation of the health care on the Flathead Indian Reservation?
I would hope that we would get to the point where we all talk positive about it, that we all promoted it, that we all treated each other better. To criticize ourselves and to look at each other negatively is not only inefficient, but not very healthy.
All right. Well, Marjorie, I think that is going to conclude this interview. I would like to thank you for coming and spending this afternoon with me. For those of you out in viewing land, I would like to tell you that this is going to become a weekly program. It's going to be called Good Medicine. It will air at 10 o'clock on Wednesday nights, at 2 on Thursdays. Oh, 6 on Wednesday. I'm sorry, I was told 10. You look at the programs. It will be better on that. I'm sorry. This will start after the holidays, and we're looking forward to seeing you. We're going to be expanding on other health issues. So, Marjorie, thank you for your time, and
Thank you.
have a good day.
You too.
Good Medicine is your program. We hope you watch this and subsequent programs to stay informed about your health care. And we'd like to hear from you about how we're doing. Please direct any comments or suggestions you have to us. You can reach us at